You're listening to a Raconteur Studios podcast.
Hello and welcome. I'm Dr. Emma Craythorne and this is the After Hours Skin Clinic, the place where your skincare questions don't stop when the clinic closes. And today we're going to tackle the Caveman Skincare trend. I'm very pleased to be joined by the wonderful Dr. Ellie Rashid. Welcome back, Ellie.
Hello, great to be back.
Now, some of you may be on it with the TikTok trends and you know exactly what I'm talking about when I say the words caveman routine. But for those of you who don't, let me explain it because Ellie's looking at me quite puzzled and I think that you have no idea what I'm talking about, right?
I have not come across the caveman trend.
Well, the caveman skincare trend, it's not actually completely new. It's been around for a few years, but recently a TikTok creator called Tia Zacher posted a video and that's the one that's gone viral. She's testing and documenting this method on her page and the internet, as usual, has a whole lot to say about it. So if you haven't seen any of these videos, essentially it shows you very close up look at her face. And as you would imagine, it's somebody who just hasn't washed their face at all. So there's a complete build-up of dead, flaky skin cells. And I'm guessing that she's somebody who probably already has a degree of seborrhea anyway. So that's just sticking and mounding up on top of each other. And in one of the videos, and I'm quoting here, she talks about that for years she had picked and overexfoliated and damaged her skin really badly. And so now she's not using any water and just letting her barrier rebuild itself naturally. And I've said those in quotation marks because I know that we don't think that can happen. She says that what you're seeing in the video is all her skin and all of this shedding and all the damage is an attempt to re-regulate itself. And it's not as if she's just sitting there and letting the skin barrier rebuild. She's still doing all of the other things that we do in our kind of day-to-day lives. She's going out, she's still exercising, still putting on makeup. And in response to all of these things, there are people who are then coming on board and saying that the only method that's ever worked for them is the caveman method, and they're posting about it saying how great it's been for them. So we're here to try and set the record straight from our professional dermatology opinion and trying to take a look at, is there anything good in this caveman method? So Ellie, first impressions of the caveman skincare trend. As a highly qualified consultant dermatologist, what are your initial thoughts?
My first impressions are, oh my gosh, please just wash your face. That's my first impression. And then I sort of think about it. And, we do see patients in clinic that we will ask them to simplify their routine, not to overcomplicate their routine, to take out all the 10-step programs and just have a very simple, 3-step, cleanse your skin, put a sunscreen on, and usually some form of moisturiser just to help your skin barrier. So I think to go to this extreme, I don't think that will have a positive impact on someone's skin.
I mean, it's really interesting, all of these skincare trends, because, sometimes some of them do have a positive benefit for some people, but it even kind of sounds like this idea of the caveman trend, it's not as if everybody's doing exactly the same thing. So some people are just not putting on loads of extra creams. Some people are not putting on their SPF. Some people are still washing, but just not washing with a cleanser. So it's not as if there's a very set rule of what you must do for the caveman trend. So perhaps if some people are just, cutting back everything and all they're doing is washing their face and putting on their SPF, and that's what they consider the caveman trend is, then that's fine.
Carry on as you were. Yeah, I think substituting some of your ingredients and, as you say, maybe using a cleanser that isn't a foaming cleanser, a nice gentle cleanser, just rinsing your face with water in the mornings and not necessarily using a cleanser, that's also fine. But at the end of the day, you've got pollution, sweat, makeup, sunscreen. Well, you wouldn't have sunscreen if you don't the caveman method. But you've got pollution, sweat, makeup, debris, just all on the surface of your skin. And if you're not cleansing that in any way. So does she think that's a really good look? Because I've seen the image, but I just didn't realise that it was related to the caveman trend.
It's not actually about thinking that it looks good at that moment. It's almost that this is considered a transition. And if you get through this part, then it's going to be amazing. It's a bit like the idea of just never washing your hair or washing your scalp, because if you can get past that point, then the scalp will, and I quote again, regulate itself, and then your hair will just be glossy and wonderful forever. They think that there is a point, if you just get past this, it's going to be okay.
But she's not got she's not there.
She'll never get past
Yeah.
Just to remind you, Ellie.
But like, what's the evidence that people are looking at thinking, oh, okay, well, if I can get to that end result, then maybe this transition might be worth it. But I don't see why it's become such a trend because there's nothing to aspire towards.
So what's the evidence, Ellie, that somebody does anything if TikTok says you can do it? I'm
very
quoting from
robust evidence there, Emma Craythorne. It's where I get all of my scientific data from. TikTok trends.
But I do think it probably is a little bit of a backlash to, like you said, this overcomplication of skincare routines. You know, there is this desire to always have the next thing or the best thing, or skincare is almost seen as, you know, an ornamental collection in some people's bathrooms for their get ready with me's. And this almost feels like it is a backlash to that, to say, you know, you don't need all of these products and these products are actually damaging my skin. And this is a complete backlash to that. And I think that's probably where this has started to emerge from, because, you know, you touched on it at the very beginning, those very pillars of what skincare is. You know, our skin is really good at looking after itself. It doesn't really need much and we overcomplicate everything. But in truth, the pillars of skincare are that you cleanse your skin, because your skin does get covered in dirt and grime and sweat and everything. And then if you cleanse your skin properly, unfortunately, most people need to moisturise as well, because you've taken out some of that skin barrier. And then obviously as dermatologists, we're going to recommend you put an SPF on. So for me, they are the pillars of good skincare, and it's not really complicated. It's just that's the way it should begin. And to remove those, that seems like taking this backlash to the over-creation of marketing and skincare a little bit too far.
Yeah, it's taken it too far. I can see a subgroup of patients that would probably benefit from a version of the caveman method. So if you have perioral dermatitis, where you get this inflammatory response, usually as a result of your skin barrier being affected, I can imagine a temporary improvement if you're to withdraw sort of all products from your skincare routine. And if you're someone that's got like an irritant eczema or an allergic contact dermatitis, then I can imagine simplifying things and not using ingredients or active skincare ingredients could be temporarily beneficial. But I think it's the extreme that this has gone to. I think a really good approach would be just to simplify your skincare routine. And right, as we said at the beginning, cleanse your skin, SPF, and a moisturiser. And that's it.
In dermatology, there is a condition called a dermatitis neglecta, isn't there? Where essentially you've just neglected to look after your skin. And it presents exactly really as how Tia's video is, where especially on the face and somebody who has a lot of oil, the skin cell turnover tends to stick a little bit. So instead of washing away all of those dead skin cells, they do just build up on the surface of the skin and then create, I always think it looks like almost like an armour or a fish kind of scale on the face that you really just want to, I just want to go and pick off because it's stuck down. And I think that for some people moving into that territory, it really is a dermatology diagnosis.
When I was pregnant, I couldn't reach my ankles. And so I couldn't cleanse them adequately. And I remember looking down at my ankles and seeing exactly as you say, that sort of like fish scaly, ichthyotic appearance.
Grime.
And I'm thinking, what on earth is going on there? I was like, it's because I can't reach them.
Yeah.
So then I had to get my husband to help.
I remember once being asked to go and see a patient on the ward as a dermatology registrar, and it was an older man who'd been brought in, and he really was unwell for many reasons. He had dementia and he had essentially dermatitis neglecta, so nobody had really cared for his skin, his scalp, and he'd just been in a bed. And I'd been asked to go and see him because his scalp was green. He had really like vivid grass green head, and the doctors didn't know what it was, and so they called the dermatologists, come and have a look and see what this is. And anyway, I went in and it's exactly how I've described, you know, stuck down skin cells. And I just peeled these skin cells, you know, the clumps of dead skin essentially away, and it was everything green, bright green, was just in the dead skin cells. The skin was fine.
Infection.
He didn't have a pseudomonal infection. I said he must have been in contact with some green dye. Anyway, it was new green pillows that his daughter had put on him at home, and the dye had seeped through to these dead skin cells that were then stuck to the back of the scalp. So that was, the diagnosis.
Diagnosis, trendsetter. Management plan, wash.
And that was it. And I remember all the other doctors looking at me thinking, what weird and wonderful diagnosis is she going to come up with? This green skin, like the Incredible Hulk. I said, it just needs a little wash.
Yeah, just a little bit of cleansing. Job done.
So can you think of any situations other than perioral dermatitis or irritant dermatitis where this might be a good thing? Because one of the things I was thinking of is it's almost a little bit like cold turkey for people who are a bit obsessive with skincare and almost OCD with skincare. And I just wonder sometimes to go almost the opposite way. Is that a good thing to try and break that cycle that people get into about over-obsessing about their skin?
Yeah, over-obsessing and over-complicating. So, I do think there's a role to simplify a routine, for sure. It's gone a bit too far one way. And so maybe for people that get caught up in buying every new skincare product, spending, hundreds and thousands of pounds on new devices and new skincare ingredients and all of these expensive products, then, maybe for someone like that, this would be a good trend to embark on.
Let's think of the real risks that go alongside it and the problems. I mean, the first thing, I suppose, is to state the obvious that your barrier recovery, if you're somebody who's got a sensitive barrier, it does not require complete withdrawal of all topical treatment. In fact, it would do better with adding in some very ceramide-rich moisturisers and gentle cleansers. So I think that if you really do want to repair your barrier, by doing this trend, you're actually just delaying rebuilding your barrier. This is not going to be the answer.
Step backwards. And I guess the other thing is if you're not putting sunscreen on and you're someone who is going to get burnt with sun exposure, then again, that is a real risk and you're potentially increasing your risk of skin cancer in the future, cumulative risk of skin cancer. So another reason not to really embark on this trend.
And I think as well, if you're allowing all of your sebum and keratin to build up on the surface of the skin, it's a really lovely breeding ground, isn't it, for lots of the fungi that like to live in our skin and also lots of other bacteria. So you kind of swap over what that microbiome might look like. And your skin is going to be in a position where it's probably going to have an overgrowth of bacteria or fungi that are more inflammatory to the skin.
Yeah, and yeasts on the skin as well. All of it. I think you're going to have issues if you're altering your microbiome in such a dramatic way, in the same way people, embark on diet that really changes their gut microbiome. And I guess, we live in a society now where we are exposed to a lot of pollution, we are exposed to a lot of UV radiation, and, lots of us are exercising and putting makeup on. And so there are lots of ingredients and things that we're putting onto our skin that do need to be cleansed off. Otherwise, we are dramatically altering our skin microbiome, and it will have an impact on our skin health. Probably in a negative way.
Have you ever followed a TikTok trend or a trend that you look back and think, oh my gosh, why did I do that?
Yes. But it wasn't like a TikTok trend.
Well,
it was
yeah.
TikTok wasn't around then.
30 years ago.
There was a trend. It was just like a thing at school that people were doing and everyone was doing it. To do the thing where you'd get like the top of a deodorant spray and then you would put it over your lips and the suction from doing that would give you these really full looking lips. The trends were just someone would set it off and then it would sort of go around the school and everyone would do that. But I remember looking back on that trend and thinking, what on earth? But why? What was the point of that? That was probably the trend that sticks out.
This was a trend that went around at school, but actually I kind of think now it probably had a little bit of logic to it in a way. You would boil some milk and then you would let the milk cool, and that film that gathers at the top of milk whenever it cools. So taking that film off and then putting that onto your skin at nighttime. Yeah, that was one that I did. I think I did that for about 3 months in the hope that it would make me look...
For 3 months?
Yeah, make me look really young and beautiful when I was like 13. And I was really, really young.
Exactly. And I literally, we're doing that as well with the lips. And it was like, you're 12. What are you going to achieve with that? Your lips are literally the most gorgeous they will ever be.
So if we were, as our professional hats on as dermatologists, thinking about other evidence-based alternatives to the caveman skin trend, how do you think we should approach this?
I think we should approach this by advising people and patients that you should simplify your skincare routine, but not go to the extreme of this particular trend.
So let's think you would cleanse, and that's cleansing with something that's a non-foaming, lipid-rich, gentle cleanser. That's going to be the same pH as your skin. It's going to do as minimal disruption to the skin barrier as possible, and it's going to gently support the skin barrier if that's what your intention is of trying to do this caveman skin trend in the first place, of having a supportive skin barrier. Moisturiser,
you want to use something that's got ceramides in it, some humectants like hyaluronic acid and glycerin to try and improve the hydration in your skin. Again, something non-fragrance, not likely to irritate your skin. Lovely, gentle, just to help with hydration and help with moisturising your skin.
And there is those barrier moisturisers that have this lovely, gorgeous percentage molecular ratio of cholesterol-free fatty acids and ceramides. And that is meant to be the optimum way to keep your barrier in tip-top condition. Yeah, I would agree with that. And your SPF, please, just put that on.
Oh yeah, just put that on. I mean, you literally couldn't bang on about that anymore.
And then I would probably say, at that point, if you've got issues with your skin, look and see what they are. Do you have some dandruff? Is there some redness? Is there some scaling? Where that is this a dermatology condition that needs a bit of extra help? And then use the right kind of medical treatment normally for that extra help rather than kind of guessing what it might be. But take it back to the basics. Monitor for any signs of why you think your barrier had a problem with it in the first place. And then get good dermatology advice to help you pick what else needs to be added in if something else does.
Yeah, absolutely. And that medical advice that we might give doesn't necessarily mean that we'll advise a medicine.
Yeah.
It might be something as simple as looking at your skincare routine, realising that you're using something, I don't know, like tea tree oil on your very dry eyelids. And that's actually making your eyelids really dry and scaly and flaky. And therefore, you just need to stop using that. But you just want to go to someone that has experience in managing dermatological conditions so that you can get the right advice for your particular skincare concern.
Should we go through some recommendations that we think of for a cleanser? Should we do a cleanser each?
Yeah, so my cleanser of choice for someone with sensitive skin that's lovely and gentle would be Avene Tolerance Gentle Cleanser.
That is lovely. That is very nice. I do love the Cetaphil Gentle Cleanser. That's
gorgeous.
A great one to go for, isn't it?
Yeah.
I also like as well that, which you put me onto, the SVR to Pyalize, the oil.
Oh, yes.
I think that's quite
really
good.
Nice.
So if somebody has, say, for example, in a situation like this where you've got lots of dead skin cells stuck to your face because you haven't washed it and you've got all of that sebum build-up, I actually think that SVR to Pyalize would be a good place to start to get all the dead skin cells away.
I wonder what her skin's going to look like if she actually takes on our recommendations. Tia, if you're listening.
We love you. Moisturiser.
So moisturiser, I really like CeraVe. CeraVe's moisturising lotion, CeraVe's moisturising cream. Nice, simple, full of ceramides, not fragrance. Easy to use. Pretty much everyone can use it.
I really like the La Roche-Posay Toleriane if you're thinking about some kind of barrier protection, or the Lipicar Balm AP+M. And the other one that I really quite like, which was just introduced to me quite recently, and I think that people who are wanting to go down a more natural route of things, is the Avene gel cream. It's a really super light cream, but it's almost like in a gel format. I think that's very nice too, so I would add that into the mix.
SPF?
So if we're going to go for an SPF for somebody with very sensitive skin, I like the La Roche-Posay Anthelios Comfort Cream.
Great. I like the Avene, the orange one.
The Avene
SPF 50.
I love the Avene SPF 50 with the Tinosorb.
Yeah, what's the is it just called Sensitive? Yeah, it's the orange packaging.
Yeah,
and I like that.
And
one.
It goes into the skin in 1 second.
Yeah, it's
so
lovely.
people really do like that, yeah. I suppose one of the things that Ellie is like, as dermatologists, our role isn't really to just dismiss these trends outright, because actually you do learn quite a lot from TikTok trends, and you do learn that sometimes some of them actually do benefit some people, and it's often just taking it right to the very extreme for others is probably where the problem is. But I really quite like dissecting these. And then if we can come up with some kind of safer, a bit more scientifically sound alternative that really respects the skin, then we should keep doing ones like this.
Yeah, I like doing this type of episode because I think you're right. The trends are there for a reason. People are interested in it and people want to learn more about it. It's more about us putting our professional hats on and just making sure that the right type of person is following that particular trend and not taking it to an extreme.
I mean, I learned the 2-finger rule for SPF from TikTok. And, I work in skin cancer. I spend my entire time telling people to put on their SPF. So you would have thought I would have come across this, but it was actually TikTok that drew my attention to that paper. It's an old enough paper that came from New Zealand talking about how much SPF you should put on your face. And now it is my go-to explaining to people how to put SPF on their face by squeezing out the bottle to get 2 fingers along their index and middle finger, and that's the amount of SPF you need for your face, which is much easier than the teaspoons, the half teaspoons, the egg cups, the shot glass.
So complicated.
Yeah.
Who on earth is doing that? Like, let me just measure out teaspoon worth. No, I do the 2 finger lengths, but I don't put it on my fingers. I just do the equivalent of the length that I know that my 2 fingers would be on each cheek and then just rub it in.
Yes, it's not the same thing.
You're basically
TikTok.
not following the trend.
That's your version
I'm
of
such
that
a
trend.
rebel. I'm such a rebel.
So I suppose to sum this episode up and going full caveman, what do we think?
No.
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 Just a little bit caveman.
A little bit cave woman.
So that's a wrap for today. Let me know what you think about the caveman method in the comments. And if you want more professional advice on confusing TikTok trends, let us know. And if you're enjoying this podcast, make sure to follow and subscribe wherever you're listening so you don't miss another episode. It also helps us reach more people. That's bye for now. As always, thanks for joining me, Ellie.
Always a pleasure.
And thank you, my lovely listener, for joining us. Take care of yourself and your skin. Wear your SPF and see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.